I have been in healthcare since 1996. I started in a tiny hospital in central Pennsylvania that was completely under-resourced. I very quickly drank the Kool-Aid. I believed in technology and healthcare. I was an RN in the emergency department and soon jumped into IT, managed the IT department there. I proposed investing in our technology. I proposed investing in innovation, and unfortunately it was too little too late. I worked in an organization that declared bankruptcy, and I was one of the last people out to turn off the lights. I believe in where we're heading. I believe in what we're doing. There are more and more patients to treat, sicker and sicker patients to treat, and less resources to do it with. So finding new, creative, innovative ways to provide that care, I'm in. Geisinger, Dr. Steele has said it himself, whether it was by terrific planning or dumb luck, it invested wisely in itself. Years ago, they invested very early and very heavy in their technology, and I feel like we're really starting to leverage that investment to see tremendous returns. Again, the ability to provide care with diminished resources, with the amount of care that's required, the things that we need to do don't decrease. It gets harder and harder to do, and with less and less resources, we now have the capabilities to, in some ways, impact the way we do that. Not just valuable, it's core, it's key to everything that we've done. I wouldn't want to represent the entire organization. There are innovations going on all throughout the organization. I know that there are people who are working on patient flow and bed utilization and resource utilization and improving the way we schedule patients. I mean, there's just tremendous things happening. Specifically, I mean, I could talk about my small group. We do clinical analytics, clinical decision support. We're leveraging the data that comes from all the disparate systems, not just our EMR, not just our but compiling that and collating that with all the data that comes from all the other systems, pathology and radiology and so forth, and using that to make decisions about patients, to find patients that need our help, that in the old paper-based systems and actually in most of the existing EMRs are still going to slip through the cracks. Finding those patients and identifying those needs, and in some instances we're actually able to automate the delivery of that care. Clinical agreements, best practices, national guidelines all indicate these are the things we should be doing for this population. We can now determine if that's being done, and we're at the point now when it's not, we can automatically do that. No intervention required by providers. We're cutting the expenses required to provide that care.
Super.
We also use those analytics for not just this proactive approach, but as a safety net to determine the patients who, without specifically looking individually, patient by patient, we would never know are slipping through the cracks. They've got comprehensive test management where patients have had an abnormal result that requires some sort of follow-up. And whether it be by a provider oversight or by the patient's own actions, they're still not getting the appropriate treatment. We're able to determine that and get them in for that